slides. Thanks. I should explain to you, given that you're a natural experiments oriented network, that I'm talking about complex interventions in generally rather than directly about natural experiments, but much of the content of the new framework is, I think, relevant to any kind of evaluation, whether you're using a planned experiment like a trial or a natural experiment. There are obviously some key differences, and I'll come back to those in a moment, but many of the interventions that we're interested in when we're applying natural experimental methods, you know, things like new policies, pieces of legislation, other large-scale programmatic interventions, these would all easily count as complex. And as I'll try and explain later on, that there are a few interventions that can't usually be considered as complex to some extent. And much of the new framework is really concerned with the practical aspects of evaluating complex interventions, and these are issues that are often overlooked in the natural experimental methods literature. So I hope that the new guidance, the new complex interventions guidance, will be useful to people who are working in a natural experiments, working in the natural experiments tradition. And then finally, before I begin, I should just point out that work has just begun. Frank's involved in this as well, on an update to the MRC's natural experiments guidance, and we hope that that will deal with a lot of these pragmatic issues as well. But in the meantime, the complex intervention framework, I hope, will be useful to people when they're planning and conducting natural experimental studies. So, acknowledgements. First of all, there was a big team of people involved in developing the new framework. The authors are listed at the top. The ones with stars against their names were participants in the month webinar that we held a few weeks ago, and I've borrowed some of their slides. So this is my way of saying thanks to them for being able to do that. We were funded by the Medical Research Council and the NIHR, and they had an important role to play in shaping the guidance, not just by providing the money. We were helped by admin colleagues at the unit where I work, but we also consulted a lot when we were developing the guidance. We had an expert workshop. We presented workshops at various conferences during the years when we were developing the new guidance. We had a formal consultation on a draft, and we invited feedback on drafts specifically from various people, and we convened particular meetings focused on different aspects of the guidance, in particular intervention, development, and the use of systems methods. So there were lots of people involved in developing the guidance, and that's important. We hope it will be, you know, useful to a very wide spectrum of researchers, and we're anxious to make sure that we got all those perspectives directly engaged in formulating the framework. Okay, so just a little bit about the link between natural experimental approaches and the other approaches that we talk about in the guidance. This is a nice way of drawing out those distinctions. It's based on work by David Ogilvy and Martin White at the MRC epidemiology unit in Cambridge, and I'm glad to acknowledge the useful work they've done here. So that they draw this distinction between two modes of evidence generation. This is the traditional evidence-based practice pathway. Researchers develop an intervention, they take it through various stages of feasibility and pilot testing, they test effectiveness in a trial, the results of the trial are synthesized along with the results of other relevant studies, and hopefully at the end that informs policy action. Natural experiments work in a somewhat different way. It's the initial intervention obviously is outside of the control of researchers. It might be derived, the interest in that kind of intervention might be derived from things that are happening in the political, economic context, or from things that people have observed, trends in health and so forth. That leads to policy action. The possibility, the feasibility of evaluating the intervention is assessed in the planning of the study, the evaluation is carried out, the evidence is synthesized, and again, hopefully that feeds back into policy development. But these two pathways, although they operate in a slightly different way, have a great deal in common, and that's, I think, is why the new framework is relevant to both. natural experiments and to planned experiments, the kinds of things that we do in the context of a randomized trial. So that's all I'll have to say directly about natural experiments. I'll move on and talk a little bit about, first of all, the motivation for updating the MRC's guidance on evaluating complex interventions. So why did we get involved in this in the first place? The 2008 guidance was still being widely used and widely cited, about twice a day, according to these figures from Web of Science, which are actually quite a conservative estimate of the extent to which the guidance is being cited. You get a much higher number if you look at, for example, Google Scholar. So lots of people were apparently still finding the guidance useful to some extent. But in the 10 years or so, since the guidance was published, we're aware that lots of more specific guidance had appeared on the use of natural experiments, for one thing, but also on process evaluation, on the development and adaptation of interventions, evidence synthesis, and so forth. And we wanted to bring some of that together. But more importantly, there's been a lot of new thinking about how interventions achieve their effect. And in particular, there's been a growing recognition of the importance of context. And that's something that's easy to overlook if we think of interventions primarily as discrete technologies which are largely defined by their components, which is how the old guidance defined complex interventions. So in the new guidance, we wanted, first of all, to fill some of the gaps that the other bits of guidance had helped to highlight. Some of the gaps as well. There was very little attention paid to health economics, for example, last time. So we wanted to bring all that together, but we also wanted to incorporate this change in thinking about what makes a complex intervention complex into the new guidance, and that was really the prime motivation for doing the update. So just to try and encapsulate the new concept of a complex intervention, which we're trying to highlight. The example I like to use is this one. It's known as the lucky iron fish. You may have come across it in the past, yourselves in the past. You can buy one of these from Amazon if you want. But basically, the lucky iron fish is a small metal ingot which is designed to be placed in a cooking pot when you're cooking rice or boiling food generally. And it was designed to help prevent dietary anemia amongst indigenous peoples in Cambodia. And on the face of it, the lucky iron fish is a very simple intervention. It's just this little lump of iron. But if you think about the whole process of delivering and implementing an intervention to get this lucky iron fish into the hands of the people who need it, getting them to use it and keep on using it, then you can begin to see that actually, even with an intervention which has basically no internal moving parts at all, can usually be considered as being a highly complex intervention. There's a whole supply chain that needs to be considered in getting it to the right place. The effects of the lucky iron fish will vary according to context. They found when they tested it in Cambodia that the chemistry of the water that people are using changes in the rainy seasons, the dietary availability of the iron that reaches out of the ingot into the cooking water changes. There were a whole series of cultural influences on the extent to which people were, willing to use it, and so on and so forth. So you think about all those aspects, you can see that even these are ostensibly simple interventions have a great deal of complexity in the way that they achieve their effects. And it was this wider range of mechanisms that we wanted to incorporate into this new thinking about complex interventions. We also wanted to emphasize the value of using a diverse range of research perspectives. We didn't want to sideline the emphasis on efficacy and effectiveness that you traditionally see in trials, but we wanted to add to that other ways of thinking based on theories and based on systems thinking as well. One of the important things we wanted to do was to shift the focus of evaluation work away from a kind of exclusive concern with obtaining unbiased estimates of effectiveness towards thinking of the production of evidence in terms of the value of evidence for decision making, and to use that as the basis for determining the perspective you take to your evaluation, the kinds of questions that you seek to ask. And we also wanted to make sure that we gave due attention to the parts of the evaluation process which go on around the assessment of efficacy or effectiveness, the development and adaptation of interventions to begin with, and also to interventions which originate outside of research teams, the kinds of things that natural experimenters are traditionally interested in, changes in policy, legislation, health services delivery and organisation, and so on and so forth. So all those things are the things that we wanted to emphasise in the new guidance. We've gone very briefly to think about how we went about developing the guidance. It was a much more formal process than we undertook last time. We were more systematic in the way we gathered information, and also more systematic in the way that we tried to incorporate these different perspectives. So we had a formal governance structure for the updating work, which involved a whole range of people from different backgrounds: health technology assessment, health services research, public health, health economics, and so on. And I hope that range of perspectives is evident in the content in the content of the guidance that we produced. Okay, so the basis of the new guidance is this notion of interventions as events in systems rather than as discrete technology, and we want to advocate the use of systems thinking as a way of understanding how it is that interventions achieve their effects through the interactions with the context in which they're implemented, rather than just as a result of the mechanisms which comprise the intervention narrowly defined. So systems thinking is an important but not exclusive part of the new guidance. Methodologically, we wanted to take a pluralistic framework, a pluralistic approach, identifying all these different perspectives that can be used to guide the design and conduct of complex intervention research. And importantly, we don't see these as necessarily mutually exclusive. So if you're conducting a study to evaluate effectiveness, then you might also want to draw on theory and think about your intervention as taking place within a system at the same time. So these perspectives are overlapping rather than mutually exclusive. And the choice of perspective we wanted to emphasize should be made from the point of view usefulness of evidence, given the uncertainties that exist about the intervention being studied, given what's already known about the way interventions of that kind work in different contexts. And in doing this, in emphasizing these things, we're not saying that conventional approaches, randomized trials, focus on effectiveness are no longer useful. What we are saying, though, is that exclusively focusing on those things will leave important questions unanswered, and that research will be much more useful for decision makers and less wasteful of resources if we also pay careful attention to issues around feasibility in the early stages of implementation later on. If we use systems approaches alongside other research perspectives, and then we focus on the key uncertainties facing decision problems when we choose our research perspectives. So a broader way of thinking about understanding effectiveness. So the new framework, like the old one, has a kind of phased structure, beginning with developing or identifying intervention, take account of interventions that are generated outside of research teams through the policy process and so on, then moving through feasibility, evaluation, implementation. But what we were very concerned to do in the new guidance was to emphasize a set of core questions that should be considered at each of these stages. So these are not things that you think about at the start of the process and then move on from. They're questions that should be revisited throughout the process of developing and evaluating, then implementing a complex intervention. And for the few minutes I've got left, I'll just go through these 6 core elements in turn to try and capture the approach that we're trying to set out. So 6 different elements. The first follows from what I've already said about interventions as events in or as interruptions in complex systems. It's vitally important to think about the context in which an intervention is being delivered. By this we mean any feature of the circumstances in which the intervention is actually happening. We know it's conceived, developed, evaluated, implemented, and so on. There's a whole series of elements of context or dimensions of context that need to be taken into account. A wide range of things that might affect the way the intervention achieves its effects. There's other guidance which suggests, which lists these kinds of elements. They don't always need to be taken into account in every evaluation, but researchers should at least be thinking about which elements of context are likely to be influential in terms of the way an intervention achieves its effects. So again, first core element is context, should be thought of, should be reconsidered throughout the evaluation process. Second core element that we want to advocate is the use of a program theory, a formal depiction of how the intervention is expected to work and under what conditions it's likely to be effective. We advocate strongly for the involvement of stakeholders outside of the research team in the formulation of this program theory, so that the questions that are highlighted by the use of the theory are ones that are relevant to stakeholders who ultimately be the people who are implementing the intervention in wider practice. The program theory is not something that you set out at the start of the process, we suggest, but it's something that you continually revisit and refine throughout the evaluation work. And an improved program theory based on all that work should be seen as an important evaluation outcome. So we're not just interested here in the production of effect estimates. It's very much about understanding how an intervention achieves those effects and encapsulating that within a program theory. The third core element I've already mentioned, the importance of involving stakeholders. By stakeholders, we mean anybody pretty much with a stake in the topic. It can be people targeted by the intervention, members of the public or patients, or people involved in delivering it, or anybody whose interests are likely to be affected by the presence or absence of the intervention. And the reasons for engaging stakeholders will differ according to the context and the phase of the research. So careful thought needed about how and why and who needs to be involved from the stakeholders' point of view. And there are clearly the trade-offs involved in engaging stakeholders closely, and we discuss some of those trade-offs in the guidance, and I can come back to them if that's something that people are interested in. The fourth element that we think is important to keep in mind throughout the process is to be clear about what the uncertainties are that evaluation can usefully be addressed, that the evaluation can usefully address. These uncertainties will depend very much on what's already known about the intervention in question, the evidence that's already been gathered from similar interventions or the same intervention but delivered in different contexts. If you're designing and planning complex intervention research, it's not necessary to deal with all the complexities at once, but what's important to try and focus on is the big gaps, the key uncertainties where new evidence will really help to inform future investment or implementation decisions. So thinking carefully about what those uncertainties are is very important. The fifth element is about the refinement of interventions. Rather than seeing the intervention as something that has to be set in stone and fixed right at the start of the process, there's value in fine-tuning or adapting an intervention as you go along and evidence emerges throughout the process. Obviously, the evidence you're producing is going to be more relevant if it's the best possible version of the intervention that's being evaluated. An ongoing refinement can help to aid that process. It's not to say that anything goes and the intervention can just evolve willy-nilly as the evidence is gathered. It's important to set boundaries for what kinds of refinement are and aren't permissible at the beginning, but refinement should be allowed to happen where it's indicated by the emerging evidence. And then the sixth element, and this is something that was probably underplayed in the last edition of the guidance, and for which the last edition was justifiably criticised. We think it's very important that economic considerations are given due weight and considered seriously throughout the evaluation process. I think too often economic evaluation is something that's tacked on to the end of the evaluation process. There's lots of value to be had from engaging economists much earlier than that, and applying economic thinking not just to the evaluation of the intervention, but also to the question of whether the information that's going to be generated by the research process is worth the cost of gathering that information. So involve economists early on, incorporate economic considerations into the program theory, but also into the decisions that are taken about the research strategy and research decisions that are made. In recommending good weight is placed on economic consideration, we're not suggesting that there's a great deal of work to be done to develop new economic methods. There's already a wide range of approaches available that evaluators can draw on, and it's using these approaches well that is likely to generate most value rather than seeking methodological innovation for its own sake. And we make various recommendations for the kinds of approach that are likely to be appropriate when you're thinking about a complex intervention and the kind of perspective that should be adopted in any economic evaluation of a complex intervention. So those are the key elements. There's obviously lots more in the framework. It's quite a lengthy document, but I hope that's given you at least some degree of insight into the thinking that's gone behind the update and the kinds of things that we want to emphasise in applying the new framework. Very, very happy to take questions. As Frank mentioned, we've already held a webinar to launch the new framework. I've got some questions that emerged from that I can flash up, but I'd be much more interested in hearing about your questions first before I do that. So, Frank, should I stop sharing at this point or leave the slides up?
Yeah, thank you very much, Peter. That was a great talk. Yeah, if you stop sharing, and I think because we have just over 40 participants, so I can't see them all, and I won't see a waving hand. So if you can just type your questions, and then we'll do them once they come up. So there is already one question for you, Peter, from Scott, about the economic consideration. Is this limited to health economics, or does it encourage people to wider? I work for a local authority. Our directors are more interested in savings to the local authority, not just health, which the CCG will benefit from.
Yes, so that's exactly the kind of perspective that we recommend. If you think about a complex intervention, obviously it can have, potentially quite wide-ranging effects. So rather than advocating, the use of, say, a health services perspective, we would advocate for a wider societal kind of perspective, so that the costs and benefits that accrue across, all the potential sectors where effects occur can be included in the economic evaluation. So, potentially savings, but also benefits to the local authority, but also costs and benefits that are wider than that as well. But yes, a wider rather than a narrow perspective is the one that we advocate in the framework. Yeah.
Thank you. While we wait for any more questions, I'm just abusing my position with a question. So in the B&J article I was reading about this, there's quite a lot of focus of kind of moving away from unbiased, trying to generate unbiased estimates and move more towards, I think it's called evidence that policymakers want to know. I was wondering, what's the implication of that for downstream evidence synthesis?
Well, I think by advocating the use of a wide range of methods, we are obviously hugely complicating the business of evidence synthesis. If, for example, you want to weigh up all the evidence in terms of whether it's biased or not, it's much easier to do that if you're just thinking about trial evidence, and if you're thinking about evidence from, trials and the whole range of natural experimental designs. But I think, I think a bit wider than that. What we're suggesting, I think, does in some respects make evaluation, more demanding. By saying that we shouldn't just focus on producing unbiased evidence of effectiveness. We should be thinking about usefulness of evidence. We're implicitly saying that there's a trade-off between, precision on the one hand, the kind of precise estimates you get from a well-designed trial, and the more wide-ranging forms of evidence you get by using a plurality of methods. So there's a trade-off between precision on the one hand and usefulness at the expense of precision on the other. And what we're suggesting really is that the needle shouldn't be pointing purely in the direction of precision. There's value in thinking about usefulness of evidence, even at the expense of some loss of precision, by thinking about the whole range of different ways in which an intervention can achieve its effects. I mean, it's not particularly useful from a decision-making point of view to have evidence from a very restricted setting, because the setting in which you're going to be implementing intervention yourself is likely to be very different. So to some extent the benefits of provision are slightly misleading. A lot of that precision will be lost when the evidence is translated into a different setting. So thinking more broadly in the first place, we think is likely to be valuable.
Thanks, Peter. A couple of additional questions have come up. The first one is, what's the role of realist evaluation for the framework?
Okay, so this came up in the initial webinar as well, and people were asking, well, isn't this just realist evaluation all over again? And it kind of is and it isn't. I think what we say is completely compatible with realist evaluation, and one of the big values or benefits of realist evaluation is the way it emphasized the importance of context mechanism interactions in producing outcomes. So we're very happy to acknowledge that. But the new framework isn't just advocating realist evaluation. I think one of the problems about realism has been that it was, I think, initially attached to a very specific kind of epistemology, which somewhat narrowed its scope, and it led to, I think, a somewhat unhelpful debate about whether or not trials could be considered within a realist framework. We firmly believe that they can, that realism is compatible with a wide range of different approaches to identifying effects, but usefully, realism usefully adds an emphasis on context intervention interactions, which was quite often overlooked in traditional thinking about randomized trials. But the two approaches, the traditional trials approach and the realist one, are approaches that complement one another. There's no need to have a debate about which one is superior or most useful. And so the framework really tries to incorporate the two approaches and others as well within a common framework, rather than emphasizing one rather than the other. So yeah, realist evaluation does have an important role in the framework, but we're not advocating for realism as opposed to other approaches.
Thank you. Yeah, the next question is from Heide Busse, and basically asks if there's specific elements of the guidance of particular importance for evaluation of digital or e-health interventions.
Yeah, again, not my own specific field of interest, but obviously one that's growing in importance and topicality. Some of my other co-authors do work very much within this field, Sharon Simpson in particular. With that caveat, I think what I would say is that one of the interesting things about digital interventions is that they can be developed and adapted very rapidly, because the costs of updating them or refining them are much lower than they are with some kinds of interventions where you would have to retrain a whole bunch of therapists, for example, or a whole bunch of nurses who are delivering the intervention, and that would obviously constrain what it's practical to do in the context of particular evaluation. Digital interventions allow for, really rapid prototyping and updating, so they fit very well within the kind of framework that or the kind of approach that we've advocated of, refining the intervention as you go along, rather than fixing it at the outset of the evaluation process. And there are ways also of adapting trial-based methods to take account of those kinds of refinements, deliberately designing adaptation into the design of the trial, and varying the intervention, components of the intervention, and the way people are randomized to receive different versions of the intervention as you go along. So I think what we're suggesting is, it's helpful for evaluating those kinds of digital interventions, and the two go well together.
Thanks, Peter. There was a new question from Siv Nygaard, the presenter of the next seminar here later this month. How do you see environmental considerations of an intervention, and should they be considered similar to economic considerations, or are they contextual factors specific to an intervention?
Well, clearly sometimes they will be contextual, in the sense the same intervention might have different effects in different kinds of settings or environments. So I think that's uncontroversial. The other part of the question, is really about, I guess, how central are environmental considerations. We've said that economic considerations are central. They should be considered every time. And others have asked, well, why are you privileging economics here? What about social, legal, ethical considerations? Aren't they always central? Well, yeah, I guess they are always important. But again, from our perspective of, thinking about evidence in terms of usefulness, for decision making, nearly all interventions incur a cost. So it's always valuable to think about whether the cost of the intervention is justified by the benefits. That's the sense in which, economic considerations are fundamental. If you want your intervention to be implemented, then providing potential implementers with information about the costs as well as about the effectiveness is really, really important. And that's why we emphasize economic considerations. It's not to suggest that the other things are not equally substantively important, but they don't have the same kind of, I think, methodological role that economic considerations have in the evaluation of interventions. So yeah, all the environmental, legal, and social, ethical, yeah, all very important too, but not quite in the same way as the economic considerations are.
Thanks, Peter. We don't have any new questions. We do still have a bit of time. Oh, we do have I think 2 questions suddenly popped up. Yeah. The first question is, can you share an example of applying this framework in evaluating a specific complex intervention? What outcome measures within the system did you or your colleagues find meaningful?
Yeah. In the framework itself, we've tried to include a particular case study to illustrate all of the key recommendations that we're making. So rather than just, kind of flying kites, what we've tried to do is, in the guidance, really to run on the basis of, convincing examples where the methods that we're advocating have been used successfully in practice. So yeah, to answer that question, I'd refer you to the long version, the monograph version published by the NIHR, the guidance, which has case studies for each of the key points that we try to make. Along with that, it possibly we're saying that there's not a lot that's truly innovative in the guidance, and that's because we are trying to accumulate and pull together, things which have been, tested and found to work so far, and to do that we have, by and large used, specific case studies rather than, general principles. And yeah, outcome measures, that's very, very specific, I think, to specific, to particular interventions. There's not a generic set of outcome measures for complex interventions that you'd want to advocate being, always being used. These are questions that you should decide by speaking to stakeholders about what kinds of outcomes are important to them, both the recipients of the interventions and the and the people delivering the intervention. So that kind of question needs to be approached very much on a case-by-case basis. I think there was a second question as well.
Yeah, the second question is from the NHS, that large funding allocations for services, pathways and interventions are routinely made. Does the framework offer guidance for service level evaluations using routinely collected healthcare data sets?
We certainly advocate the use of routinely collected data. Obviously, that's very important for natural experimental evaluations. I'm trying to think whether we use a case study of a kind of service reorganization type intervention. I can't remember one offhand, actually, but those kinds of interventions are certainly things that we would see as being within the remit or purview of the guidance. Obviously, they're being made routinely. They're not being implemented as kind of planned experiments. So you would, in effect, be forced to evaluate them as natural experiments. So I think the guidance is to some extent relevant to that, but the forthcoming natural experiments guidance will have a lot more to say about that, and in particular a lot more to say about the use of routinely collected healthcare and other administratively generated data sets.
Thanks, Peter. We don't, I think, have any additional questions. We still have a couple of minutes. I was wondering whether you would be willing to share with us one or two of the most challenging or most interesting questions you got from the large seminar.
Great. I'll just flash them up. I'll share my screen again to do that. Okay, can people see the screen again?
Yeah.
Okay. So one of them's already come up. Isn't this just realist evaluation over again? Well, to some extent it is realist evaluation over again, but with other things added. And then I saw that Frank Popham was on the call. Frank raised this question after the webinar. Why don't we just advocate for the potential outcomes framework rather than suggesting this alternative framework? And I think that the reason for that is that I think we saw the potential outcomes framework as very much setting out the underpinning logic of any kind of controlled evaluation or any kind of causal inference process that relies on a counterfactual. In the new framework, we don't really go very deeply into the epistemology underlying any of the different approaches you can take. We're much more focused on the pragmatic aspects of evaluation, design, and conduct. But I think what we do is perfectly compatible with the potential outcomes framework, even if we don't highlight that to any great extent. A couple of more questions that I picked up. Yeah, I think this is a good one. If you follow the guidance to the letter, it will make your research potentially very elaborate and time-consuming and expensive. And so the question was reasonably asked whether the funders were on board with this and whether they were going to change their procedures to take account of the extra expense. Well, none of them have none of them have yet said that they're going to do that. But I think it's also worth saying that, by emphasizing the need to think about interventions in the round and all these different interactions, we're not necessarily saying that you have to deal with all the complexity all at once every time. You can use, bits of the guidance, to best effect, and could potentially conduct a series of studies. So it should be possible to conduct studies within the framework as we've outlined it, within existing funding limits, but it will potentially take a whole series of studies to obtain all the different kinds of evidence that we're advocating as useful. Obviously, it'd be great if there were more money available and if funding limits were more generous, but there is a lot that can be done within existing funding limits. And I think to some extent the NIHR has moved away from specific funding limits, and you just have to make a case for the value for money of the approach that you're advocating. Obviously, different funders have different, some do use explicit funding ceilings, and obviously all of them, whether or not they have an explicit ceiling, have a kind of comfort zone. They're not necessarily, willing to fund above a certain level because of the overall size of their budget. But I think there is a lot that can be done with existing funding limits and expectations, though, more money is always going to be useful. And then just a couple more. What methodological innovations will be needed to make the new approach work? Well, I'm tempted to say none at all. We already have a very wide range of serviceable methods. And that's explicitly something that we say in relation to the health economics. It's using existing methods well, which is the key to generating useful evidence, rather than a great deal of methodological innovation. That's more or less the message that we want to deliver there. And then finally, I think we've already been through this to some extent. Why do we place so much weight on economic considerations as opposed to ethical and social implications? Well, it's not to say that ethical and social implications don't matter. It's just that if we're thinking about usefulness of evidence for decision making, then providing information about costs as well as information about effectiveness is absolutely vital. So those were just that was my take on the key questions that arose from the first webinar. There were lots of other questions as well, but I think they were particularly salient ones.
Thank you very much, Peter. That brings us exactly to the end of the seminar. So thanks again for willing to present the guidance and the discussion around it to the network. I'm sure everybody's very grateful for that. So thank you very much again. And I just wanted to finish the seminar, but just again pointing out that this network exists and how you can reach us and how you can join our mailing list. And also I would like to point your attention to the next seminar, Friday, November 19. It's a busy month for us. When Siv Nygaard from the University of Copenhagen will present her study, which will be followed by a bit more of breakout groups and discussions about the different aspects of natural experiments in her project and how there's possible ways by which we can suggest some improvement or changes. So I think that will be a very interesting seminar. So thank you very much, everybody, for attending, and I hope to see you all at the next seminar. And thanks again, Peter, for your presentation.